pelvic inflammatory disease, or PID. Now, we are going to be talking about this, a lot about this, okay? Please bear in mind that when you leave pelvic inflammatory disease or PID untreated, it can cause permanent infertility for you as a woman. It can cause ectopic pregnancies where your baby doesn't develop well. You keep having abortions, miscarriages. It can also cause long time pelvic pain for you, like your stomach kind of is paining you, serious pains. So we will talk a lot about this, the causes of PID, the complications. I will explain extensively, and how to treat this thing, okay, this condition, okay. So please listen attentively. But before we start, I want to tell you about Jesus. Jesus Christ loves you. He loves you so dearly. So if you've not given your life to him, I urge you to give your life to him. You can chat me directly and I'll put you through this, and go to any living church, any church close to you, and they will also take it up from there. So sorry for wasting your time. Let's get to it. Causes of pelvic inflammatory diseases. Number one is untreated gonorrhea. Yes, untreated gonorrhea and some untreated sexual, in fact, let me not call gonorrhea first. Is untreated sexually transmitted infection. Yes, sexually transmitted infections like gonorrhea, chlamydia, and some other infections. Now, when you leave these infections untreated, what they do is they go and infect your uterus first only. That first time they infect your uterus, your cervix, they infect it only. Now, when you still don't treat them, it will now go and infect all of your other reproductive organ. Now, pelvic inflammatory disease will go to infect other organs if you don't treat it, maybe like 1 year, if you have it 1 year and you don't treat it. So this is why when you are having symptoms of infection, you just go and treat your infection. Now, I know the next question will be signs that you're having PID, okay? First of all, you can also relate these signs if you're having other kinds of infection. If you are having smelly discharges, this PID, now I'm also relating it to other gonorrhea kinds of infection, but mostly this is PID symptoms. But you can still relate it to other sexually transmitted infection because they are always together, okay? But bear it in mind that they are interrelated. But for the purpose of this video, it is PID symptoms that I'm telling you. Painful urination, okay? After having sex, you will see blood. I've already made a video on why you see blood after having sex, okay? So now you will see painful urinate when you urinate and it becomes so painful, okay? You're having burning sensations if you're urinating, your urine smells, you're having fever, you bleed in between periods. Sometimes you see that you bleed, you're not supposed to be bleeding, or you've finished your period, all of a sudden you start bleeding, okay? And you have after sex you feel pain, serious pain, or serious pain after sex, you're under your stomach starts hurting you, and after sex also you start bleeding. Sometimes it's spotting, sometimes after sex you start bleeding. In fact, before sex, days after sex, and you have this serious pain. Please, if you're having any of these symptoms, you need to rush and get proper medical care, okay? Now, another way you can get, remember we're on the causes, you can get PID is if you are exposed to abortion, okay, or maybe you had previous miscarriages and there are some infection that traveled to your uterus, okay, unknowingly, okay, or in your womb. Maybe you did the abortion yourself, you took drugs, and the fetus, part of the fetus, the baby is still there. So if you had abortion and you're still bleeding and all of those things, you need to see a doctor, okay? So most people, they have retained products oh goodness, in their womb, and they are not aware, these things will rotten and cause infections for you. This is why I advocate about being careful. Now I'm going to make a video of if you've had abortion or miscarriage, what the tests you should do so that you will be safe. This is why you need to be on this page, okay? Because apart from general health, apart from your kidney health, I'm also talking about women awareness, because the rate of infertility is becoming so much. So when you have abortion or miscarriages, okay, that you were infected, you had no idea, this can cause PID for you. Okay, now some people also have, maybe you had some surgery, they removed your ovary or something. Okay, practically anything that has to happen with them opening your cervix, or even normal physical examination, trying to find out, visualize, for people that maybe had miscarriages. If those instruments are not neat, it can infuse bacteria inside that place. So these are the previous ways you can get PID. Now, very important, most of the times there is no cause, it just happens. Bacteria just find their way inside that place. So this is why you also need to improve on your hygiene as a woman. Generally, I've made a video on how to wash your vagina and how to take care of your vagina and your vulva. Okay, I'm yet to post it, but I'll post it this week because this video is urgent. That's why I have to do it, because of the so many infacilities. You expect that video very soon. By the end of this week, I'm going to post it. Okay, so this is it. Now let's get to who is at risk of having pelvic inflammatory disease. Okay, this infection, you might not have it now. Now, this is why this video is important. You might not have it now, but who are at risk? What will expose you to having this in the nearest future? This is why you should be careful. Number one, if you've treated any form of sexually transmitted infection before, you should be really careful so that you don't expose yourself more, and make sure that that sexually transmitted infection was treated. Make sure that it was treated very well. I've already told you what to do to make sure you were treated, your infection has gone. The video, just look for that video, how to treat sexually transmitted infection so they don't reoccur. In that video I explained explicitly. So make sure that your STI was treated effectively, and you reduce the chances of you reinfecting again. Okay, you have to stop being exposed to that same infection again and again and again. So you do those things I mentioned in that video. Treat yourself, treat your partner, be careful. Okay, now another one is you are under 25. People that are under 25 have a high chance of getting this PID. When you start having sex at a very young age. Of course, when you start having sex at a very young age, there are things you don't know about sex. There are things you don't even know how to protect yourself. Okay, you just want to experience it. So this is why younger people, I advocate, you shouldn't start having sex very early. Have to learn about yourself. Even if you started, learn about yourself, about your health, how to protect yourself, and always use condom. It's not even about using condom. You can transfer infections from your anus, from yourself, down to your vagina. Okay, so that's how starting sex early can cause this. Having more than one sexual partner, sleeping with different persons, this increases your chances of having STI, and STI, when untreated, can cause PID. All right, so let's get to how you will know that you are diagnosed with PID. The tests that will be done for you. Now, number one is a blood test or a urine test. So this test, when either blood or urine, your doctor will take the test, will take your blood, or urine, you run a test and find out the microorganism, the bacteria that is causing this thing. Okay, and another one is pregnancy test. If you've been pregnant before or you're pregnant, they will use a scan. They will do ultrasound scan. They will find out, see what is going on, if this infection has already given you scar. Okay, and that is about it. So now let's get to treatments. How do you treat this infection? Please, if you don't jump to treatment, make sure you start from the beginning of this video, because there are things I explained that will help you during the treatment. So don't jump and skip immediately, because most people do it. So don't skip any part of this video before getting to treatment, because you may miss out very vital important information. You need to know everything, even so that you can also educate your friends and also prevent this thing from reoccurring. Okay, yeah, I will also talk about how to prevent this from reoccurring too. Now, so the treatment, PID is treated with antibiotics. I know you'll be expecting me to tell you the drugs. However, I will calm down. What you need to know is that PID is treated with antibiotics, and please do not take any antibiotics from anybody online, okay? Or except maybe for people I refer to gynecologists. My gynecologist usually maybe asks you to run tests because it's not in the country. Then with the test you run, he will prescribe antibiotics for you. If it is not done so, or you have a gynecologist, please don't ask anybody to give you drugs, antibiotics. Don't go to pharmacy. You remember me, I used to tell you people to go to pharmacy, but this one, don't go to pharmacy to tell them to give you drug for PID. You are doing more harm than good. That PID will come back and you continue having recurrent infection. How to treat PID is this, or any other infection. I do tell you this. PID is treated with antibiotics, no doubt. What you do, when you get to the hospital, your doctor runs this test that I've told you. Of course, this test now, that's what they will run to you. Examine you, find out if you've had PID before, what caused it, and history, and your sexual partner. He does this investigation so that it doesn't come back, so that when he's giving you treatment, he knows what to do. Now, you do this test. With the test, they will find out the antibiotic, the microorganisms that the antibiotics that they will give you has not been exposed to, because you've been taking series of antibiotics. If you still take that antibiotics again, the drug will not work. It even make the microorganism, the infection, to be more, because when they are coming next, they've already cloned that infection, this PID infection that you're having, and they will come back times 2. So you're taking antibiotics, it won't work. So this is why your doctor subjects you to go and do tests. After the test, he uses that result. He will see all the antibiotics you've been taking, and even when you're sick, even when it's not PID, even when you had normal illnesses that you were sick and then you abuse that antibiotics, they will see it. They will see that bacteria, that particular bacteria, is resistant to it. Until they find out an antibiotic that is not resistant to it, that is the antibiotics that they will give you. So you see why telling me to give you antibiotics may not work. I will give you, even the antibiotics might be too hard for that illness, or too low, or your body has recognized that antibiotic. So it can even be a very small antibiotic. You'll be wondering, this antibiotic is too small, low, but it will work. So this is why you need to go to the hospital. Please, so many people are going to quacks. Stop. Look for a good, reputable hospital. I pray God blesses me so that I will give you people money, some young girls that cannot afford these things, okay? But however, if you don't have money for hospital, you can go and go to the laboratory. You still need a doctor, however. But when you go to the laboratory, they will write drugs for you, and with the result, they will give you the result. When you reach the results, just go to a pharmacy, tell them to give you the drugs that the lab said, okay? If you don't have money, but if you have money, paramount, you should see a gynecologist. Now, most people go to the hospital and they don't see a gynecologist. What they see are normal house officers. When you go to the hospital, especially when you have your own money, tell them you want to see a gynecologist. No matter what they say, you will see the normal house officer. After you tell them that you want to see a gynecologist, and if they say they don't have, make sure most people you see are not gynecologists. Gynecologists are specialists. So all these questions you ask me, when you ask them, they will give you that money you paid. Oh, trust me, you will have the value of that money you paid when you see a gynecologist. But when you see a normal doctor, it's like me now. What I have, my knowledge is just dialysis, kidney transplant, but I have other knowledge, like these things I'm teaching you, they taught us. So my knowledge is not too big, it's small. But a gynecologist, this is what he specializes. Like asking a gynecologist things about dialysis, transplant, he may not know. He will just know small. But if you ask me, I am the king. I will tell you everything. Same thing as this special. So make sure they give you a gynecologist. If they don't have, go to another hospital. There are fertility hospitals that, even if you just ask them, do they have a gynecologist? Okay, so that is it. Like this a drug will be given to you. When you treat that when after taking the drug, still go back to your doctor. Your doctor, tell the doctor you want to rerun a test to make sure that this bacteria has gone. Now, when you rerun the test, or if you're using a lab, when you rerun the test, then you will see that the note, if you will see if there is small, you will say trace means they're still small. Don't ignore it. Resume your antibiotics course with your doctor. It depends on how many days now. When they say none, it means it is gone. When they say heavy, it means it's still there. You do it like this until you finish treating yourself. Now, prevention. Make sure that you don't get these things again by be very careful, because you've been exposed. Be very careful on your vaginal health, on the kind of, having multiple sex, partners, trying to use condoms. Be very careful of yourself. Do not use don't anal sex. If your husband puts it in the anal region mistakenly and want to put it in your vagina, say no, let him wash it, because yourself, you know what you're facing. Okay. And dirty fingers, stop it. Practice safe sex. Okay, practice safe sex. Okay, so that is about it. Now let's get to complication when you don't treat this thing. I think I mentioned it earlier, but for people that are joining me, if you don't treat PID, this is what is going to happen. Infertility. These things will go and destroy some organs that are responsible for for in your uterus. Sometimes it blocks the tubes. The sperm will not pass through, okay, to go and fertilize an egg. You will be finding it hard to get pregnant. Sometimes too, you will have ectopic pregnancy. Pregnancy will not develop in where it's supposed to develop, because there have been scars because of this infection. There's been scars. It's not, the environment is not going to be okay again for pregnancy to develop. And what happens? You get infected and you get infertility, or you keep having miscarriages. So you see, you will keep having serious pelvic pain, chronic, every time pain, your pelvic, because something is going on. So please try to treat this thing so that this complication do not happen to you. Okay, so I don't know how I did. I know I took so much time, but thank you for watching. Let me know if you have more questions, and remain blessed. Remember, Jesus is coming soon, my brothers and sisters. Jesus is coming soon, and he loves you. If you don't receive Jesus as your Lord and your Savior, you're going to hell. There's no two ways about it. You're going to hell, and I don't want anybody to go to hell that is following me. Give your life to Christ. Whatever you are going through, he will see you through. He loves you. Somebody that died for you, despite that thing you're doing. You're fornicating, you masturbate, you are, the deepest thing, you've killed somebody. That thing you are doing, he has forgiven you already. Only the thing you need to do is to accept what he has done for you. Accept him and say, okay, I accept you as my Lord. Thank you for dying for me. I believe that you are the Son of God, and I receive you as my Lord and personal Savior. This is a trust prayer that I just prayed, and if you pray this prayer, you've been saved. Contact me on my Instagram and we can take it up from there. I love you all. God bless you.